Okay, this video is about Chris Palmer. Chris Palmer is a psychiatry attending physician at one of the Harvard medical schools. And the reason I'm talking about him is he came up with a big theory. He calls it the brain energy theory, or the metabolic theory of mental illness. And there's some things I like about him. I think he's an ignoramus about nutrition. But what I like about him is, he's frustrated, like most psychiatrists are that have a brain, that their drugs don't work. Psychiatric drugs are a joke. They don't work. They make the patients worse. In the short run, they can sort of hide the symptoms a little bit, but in the long run, they cause brain damage. As Bregan said, they all cause a lobotomy. The antipsychotics cause one quickly. The antidepressants and the other ones, they cause it slowly. But anyways, listen to the things he said. There are currently no known reliable imaging markers for any of the mental health disorders. Yeah, and there's no blood markers either, because maybe they're bogus diagnoses, all right? Let's see what he talks about. He basically says that a lot of these, and it's another thing too, a lot of these SSRIs, selective serotonin reuptake inhibitors like Prozac, they're mitochondrial inhibitors. Your brain's totally dependent on energy production through your mitochondria. So how is inhibiting your mitochondria going to make things better? A lot of them have fluoride on them. Prozac is fluoxetine. That flu, when you ever hear that in a medication, that usually means fluoride. Facilitates crossing the blood-brain barrier because it binds tightly to the molecule, makes it less polar, so it's better able to get across the blood-brain barrier. Okay, so what does he recommend for his patients? He recommends they eat a ketogenic diet. Now, a ketogenic diet has been helpful in some patients with refractory epilepsy, and it slows down the brain. All right, but how are you going to win in the long term if you eat a diet that makes you constipated and increases your risk of diabetes, hypertension, obesity, coronary artery disease? You're not going to win in the long run with that either. So it doesn't make a lot of sense, okay? And he brings up the point that ultra-processed foods are formulated to be addictive. You can't just eat one, okay? People can be addicted also to sweets, to caffeine, all right, to cell phones. You hold a cell phone up to your head, you EMF your brain. But the UPFs, ultra-processed foods, they also got tons of MSG, MFG, monosodium glutamate, manufacturer-free glutamate. Well, guess what? Those are excitotoxins. They stimulate the NMDA receptor for glutamate, which is a calcium channel, allowing more calcium into the cell, the postsynaptic neuron, which is going to overactivate it. So they're metabolic poisons, okay? And then people say, oh, well, there's not really that much blood-brain barrier permeability. Oh, BS. The circumventricular organs don't have a blood-brain barrier. Some of the tissues on the choroid plexus of the brain don't have a blood-brain barrier. And if anybody has previous traumatic brain injury, or they've got periventricular flare hyperintensities from those small silent strokes, all of those areas have increased permeability of the blood-brain barrier. Talking on your cell phone increases permeability of the blood-brain barrier. Leaky gut means you got leaky blood-brain barrier. So they've got leaky blood-brain barrier, okay? So let's not kid ourselves. So eating all that glutamate, overwhelming your sequestration system of your intestinal tract, is not smart. They're stimulants to the brain, okay? If you got elevated beta amyloid protein because you eat a high-fat diet causing insulin resistance, leading to using up your insulin-degrading enzyme, then you're going to get increased beta amyloid going into the brain, and that's an NMDA excitotoxin as well. If you're magnesium deficient, as most people are, because they don't eat enough plant foods, magnesium is right in the center of chlorophyll, then you're going to have increased sensitivity to that NMDA receptor, increased calcium overstimulation. So there's a lot of problems, and what I'm basically saying is he's right, and I like the fact he's honest that psychiatric medicines don't work. And I like the fact that he's trying to learn about nutrition. But I think he's basically painted himself into a corner because he enjoys being popular. He's popular right now because he's promoting paleo, keto, carnivore. That makes you popular on the internet. But he's not stupid. He's a smart enough guy to realize that you, as soon as you go low-fat vegan, tell the truth about nutrition, nobody will interview you. Nobody will speak to you anymore. Okay, so I think that's what will happen to him down the road once he learns enough to know what he's talking about. I think he's a homosexual from his mannerisms and his voice and all this stuff. And the reason why that's a little bit interesting is you say to yourself, how could a white guy get a job at Harvard? Because these people who tell you they want diversity on their university staff, their medical school staff, then you ask them, you want diversity? How many conservatives do you have? And it'll be like 0. That's their idea of diversity, okay? Yeah, how many white Christian male attendings do you have? Probably like close to 0. They're trying to get rid of them as fast as they can. All right, well, anyways, the guy I think is trying hard. I think he means well. Here's some of his quotes. He says, that the first 2 weeks of the keto diet are often really hell for the patient, a lot of discomfort, but he thinks things tend to improve after that. I saw him giving patients a giant syringe full of like olive oil or something. I thought that was disgusting. It's really high fat. This isn't kind of high fat. This is really high fat. This is like a medically supervised ketogenic diet. You'd puke. Who wants a big thing full of oil? That's like, you put oil in a car. You don't put oil in a human. It's not even a food. It's this processed toxic thing. Okay, who wants to eat all that much meat? I think it's crazy. Okay, here's what else he says. He says, there are no psychiatric diseases for which we can give a pill and get more than 50% long-term remission. Yeah, he's honest. Psychiatric drugs stink. He says the only hope for good long-term treatment of mental health disorders is with metabolic treatment. Yeah, well, how about low-fat vegan? That's been proven to improve mood. People like it when they're skinny at a good body weight because they look good. And then their mitochondria work better. They don't get hypertension and diabetes and coronary artery disease, so they're happier. He says, with mental health disorders, because the cause is not known, the tendency is to treat the symptoms. Yeah, same thing like what we do for obesity, hypertension, diabetes, and coronary artery disease, because we pretend not to know the cause. Increased CRP, C-reactive protein, it increases your risk of depression. Frequency of mental health disorders. Anxiety is most common, then depression, then the other ones. Almost all types of mental health disorder are increasing in frequency per Dr. Chris Palmer. May indicate an overlapping cause. Yeah, they're all going up because, being fat, sick, and stupid makes you sad. Let's see. Well, my said is, what a joke psychology and psychiatry have become. They say they don't know the difference between a man and a woman. Well, if you can't tell the difference between a man and a woman, how are you going to figure anything else out? Okay, that's a joke. Atheistic psychology can't tell you what a great man is, what good art is, what a good book is, how should you live your life. It's because they're stupid. They have no moral foundation. Depression is often a recurrent episodic illness. He says that most people do not fully recover from depression. For other disorders and psychiatric categories of diagnosis, the results are even worse. Yeah, but you know what? If you do nothing, they do a lot better than if you give them those stupid pills. And you don't have other crazy behavior associated with those pills. They often, SSRIs, increase the rate of suicide. They're terrible drugs. Okay, and so he's honest. He says, Chris Palmer, Harvard psychiatry attending, says the reason most patients with psychiatric disease don't get better is because psychiatric treatments do not work well. Yay, there's the truth. Okay. Let's see what else he says. He says patients with mental health disorders are telling the truth. They really don't have enough energy. Yeah, so you give them an SSRI that inhibits their mitochondria and make it worse. Let's see. He calls his idea the brain energy theory of mental health disorders. He says mental health disorders are metabolic disorders of the brain. And I would say, why don't you try them on a low-fat, low-sodium, plant-based diet? He says the rates of all mental health disorders are skyrocketing. All right, let's see. Well, I think what's good about it is now if you could say that, I don't think that's the entire story, of course not. Poor metabolism, eating a lousy diet, it doesn't cause mental illness as much as it makes you vulnerable to it. Like some minor stressor that a low-fat vegan would ignore might tip one of these, sad diet eaters over the edge. So anyways, I just let you know about him. He does think the main problem is mitochondrial dysfunction. Okay, well, like I said, then why give an SSRI or tricyclic antidepressant, which inhibits mitochondria? And statins inhibit mitochondria. And metformin inhibits mitochondria. And so do lots of other common medicines like Tylenol, like Haldol, antipsychotic. So anyways, that's the quote session for this one. Hope you found that interesting.